I will be presenting our research on enhancing patient acceptance of robotic ultrasound through conversational virtual agents and immersive visualizations. My name is Tianyu Song from Technical University of Munich. Robotic ultrasound is promising for remote diagnostics, but there are key challenges. Unlike traditional ultrasound, where patients interact with human sonographers, robotic systems lack human empathy, leading to stress and discomfort during conscious procedures. A highly precise system is not enough. Patient's acceptance is crucial. Trust must be built between the robot and the doctors, and acceptance must be built between the patients and the robot too. And our goal is to bridge this gap by integrating a virtual agent that provides real-time guidance and emotional support. Studies show that transparency and communication enhance trust in robotic systems. Patients feel more comfortable when they can engage with the system before the procedure. By incorporating a conversational virtual agent, we aim to provide this interaction and improve patient experience. AI chatbots have been explored in healthcare, but they often lack human touch and empathy, making them less acceptable. Studies on embodied conversational agents in mental health interviews have shown that human-like virtual agents improve trust and engagement. In, in mixed reality, virtual agents can perceive and interact with both digital and physical environment, which enhances their ability to guide patients in robotic procedures. Immersions play a key role in how patients perceive robotic systems. Mixed reality exists on a spectrum from AR to fully immersive VR. Understanding how different levels of immersion impacts patient stress and trust is crucial for designing such effective systems. So our system consists of a robotic ultrasound system using a KUKA LBR EVA 7 or 800 robotic arm and a Siemens Juniper ultrasound device. We use MetaQuest 3 for immersive visualizations and all developed in Unity. And our robotic ultrasound system has force control, basically using the impedance controls to ensure safe and accurate probe positioning. To enable communication between the robotic ultrasound system and the visualization module, messages are serialized and passed between the two using the TCP socket. Therefore, virtual agent can receive robot states updates and can also send control commands back. So let's dive in a little bit into the visualization module that we implemented in Unity. The virtual agents, we want the virtual agent to interact with the patient through real-time conversation and answer questions and providing reassurance. Therefore, we have the speech-to-text engine, which we use OpenAI Whisper model, and we transcribe the user's text into a transcribe a user's voice into text and then input it into the large language model. And in this case, we use Microsoft Phi-3 3 billion parameters model. After that, the output from the large language model was then put into the text-to-speech engine. And in this case, we use with.ai cloud services. And eventually, patients can get the feedback with the virtual agent with voice. The virtual agent also has baked-in and procedurally animated animation to create natural interactions, such as grabbing the probe and making eye contact. And we use the inverse kinematic solver Final IK in Unity to accomplish this.
Good evening.
And
I'm Dr. Nova. How are you?
Hi, Dr. Nova. I'm honestly quite nervous, to be honest.
I understand your concerns, but rest assured that this ultrasound is a safe and painless procedure to help us better understand your health.
What exactly is the procedure?
During the ultrasound, I'll apply a gel on your skin and use a handheld device called a transducer to capture images of the inside of your body. It's non-invasive and it will only take a few minutes.
All right, then I trust you. Let's go.
Great. I'll guide you through each step. Let's get started and ensure you feel as comfortable as possible throughout the process. All right, we're ready to begin. You might feel a little pressure as I start, but please let me know if you're uncomfortable at any point.
Can you please explain the steps to me?
Certainly.
okay, so we also implemented the virtual agent in 3 visualizations. So the first one is augmented reality, where the virtual agent is visible in the real world, and also the robot is visible to the patient as well. The second one is augmented virtuality. So in this visualization, the virtual agent is there, and also there is a pass-through window into the reality where the arm is visible in the window and also the ultrasound probe. And the third visualization is a fully immersive VR environment where the patient cannot see the robot and also cannot see its arm. Its arm is represented by the virtual arm. And to render those virtual environment and the virtual agents, in AR we use depth-aware occlusions. In this case, we use the MetaQuest Depth API to render the virtual agents so that the occlusion is correctly handled. And in the augmented virtuality and fully immersive VR environment, we have a 3D Gaussian splatting rendering of a examiner room that is rendered in the MetaQuest. And because in the fully immersive VR environment, the patient cannot see his arm, therefore we need to track the patient's arm with the MetaQuest. And we have successfully accomplished this, and the virtual and real arm are quite aligned in sync. And after all this, the last step is to do the virtual to real registration. And in this case, we use a 3D to 3D registration with the capture algorithm with spatial anchors to ensure accurate alignment of virtual and real-world components without repeated calibration between sessions. So to evaluate our our approach, we conducted a user study with 14 participants. We measured stress levels, human-robot interaction score, usability, and workload across different visualization modes. All the participants basically need to experience four conditions. The baseline condition is robotic ultrasound without any visualization and without a virtual agent. The second one is the AR virtual guidance with the virtual agent. The third one is augmented virtuality guidance. And the last one is fully immersive VR guidance. And this is our setup. The user will be wearing a HMD and put his arm onto the examination table. The robot will move the ultrasound probe on the patient's arm, and there's an ultrasound machine right next to the robot. The screen will be streamed to the headset as well, so the user can see the ultrasound image on the arm. So we analyzed the heart rate variability during two phases of the procedure: the resting phase, where the robot remained stationary and participants were free to interact with the virtual agent, and the execution phase, during which the robot performed the ultrasound scan. And fully immersive VR virtual guidance shows the highest RMSSD values among all conditions in both the resting and execution phases, with the smallest change between these phases. This suggests that participants experience the least increase in stress during the procedure in the fully immersive environment, potentially due to the absence of the robot's visual presence, which could reduce feelings of intimidation or anxiety. However, no significance were found across the conditions. In terms of the trust in robotic system, we used this HRI score, and we found that there's a significance in all the proposed visualizations when compared to the baseline condition. And AR virtual guidance has the highest trust rating, and fully immersive VR guidance has mixed results. The findings aligned with the prior research, actually, showing that the trust in automation is influenced by transparency. And AR, in terms of usability and workload, AR virtual guidance has the highest usability and lowest workload, confirming that blending and real virtual elements provide the best experience in this case. And fully immersive VR virtual guidance has the highest workload, likely due to the full detachment from reality. So based on our study and what we found in the study, there are some insights. So the first one is the context-aware communication from the virtual agent significantly reduced anxiety. And AR and augmented virtuality visualizations preserve trust by keeping real-world cues. Fully immersion reduced stress, but made some patients feel less in control. And therefore, when we design for the patient, we always need to prioritize patient control, such as allowing adjustable transparency to balance immersion and awareness. Of course, there are some limitation in our study. First of all, is the tracking error in the VR sometimes cause misalignment between the real arm, and the virtual arm. And in augmented virtuality virtual guidance mode, the virtual agent's hand was not fully visible in the pass-through window, therefore reduce the realism. And of course, we have a participant's bias and a relatively small sample size. that could also affect the generalization of this work. The participants have uh, have a lot of experience in robotic system, and in the future we could recruit participant that has less experience with robotic system. And for the future, we should develop a hybrid VR with abstract robot feedback to maintain the trust and also uh, keep the advantages of virtual reality environment that can reduce stress. And the second one is we can implement personalization, such as adjustable immersion levels and interaction styles tailored to the individual patients. And we can even fine-tune the LLM or improve the large language model so that the virtual agents can remember who you are from the last interaction. When you put on the headset again, the virtual agents can basically interact with you from where it was before. In conclusion, our findings shows that conversational virtual agents and immersive visualization significantly improve patient acceptance of robotic ultrasound. By blending automation with human-like interaction, we can make robotic medical systems more patient-centered, increasing trust and usability. So we thank NVIDIA and the Fonera project for their support. Feel free to reach out to me with this email for future discussion. And please also visit our demo session to experience the system yourself. Thank you.